The cardiovascular system. Welcome to Chapter 5. We are going to continue our exploration of the thoracic cavity by now talking about the cardiovascular system. So both the cardiovascular system and the respiratory system are located in the thoracic cavity, as I just mentioned. They're both very closely integrated in their function, and so it's almost appropriate that by design or by evolution, or however you want to phrase that, that system ends up being sort of in the same compartment of your body, and its own individual compartment, I might add. We know the respiratory system, as we discussed in the other lecture, is primarily about collecting oxygen, and the heart is about distributing oxygen as well as nutrition and other things throughout the body. It's about keeping us oxygenated and moving forward. So let's jump right into a couple of combining forms right off the bat. And I'm going to realign my screen here a little bit because this slide is slightly off. There we go. And cardio, corano. Both of these combining forms together indicate the heart. And if we were going to use the first form, cardio, if we put our ac, our pertaining to, on the end of it, we have cardiac, meaning pertaining to the heart. And coronary means pertaining to the heart also. So what's the rub here? When we talk about cardiac, we're talking about the heart itself, the system. Generally speaking, not always, but this is pretty close to almost all the time. When we use the combining form corano, as in coronary, we're talking about the arteries that surround the heart that feed blood back to itself. So remember, as you'll see here in the lower right corner, that the heart is essentially muscle. That's really all it is. It's like a water pump, and it contracts and expands. It's a closed hydraulic system that moves fluid around the body. And so essentially it's a pump in the form of a muscle. Cardiac muscle, if you notice there, you'll see these long fibers that move transversely from left to right and right to left. And in between, you see these kind of bluish, purplish dots. Those are cells that you're looking at there, and you're looking at the nucleus of cells, and that's what you're seeing in these blue dots. When you get to anatomy and physiology, they're going to talk about the difference between the heart muscle and the skeletal muscle, and they're very, very different. The skeletal muscle does not have all these nuclei, and they're going to be significant in how the heart functions, but also in a certain pathology we'll talk about a little bit later. So cardiac, corano, both meaning heart. Cardiac is a general term. Coronary is usually more specific in talking about these arteries that you see on the diagram on the left that feed the blood back to the heart. Pardon me, just one moment here. It had a momentary error. There we go. Now we're back on track. Cardiology. This is the study of the heart. This is the branch of medicine concerned with treatment of heart disorders and diseases. And I bet you can guess what's coming next. And if you said cardiologist, you nailed it. The cardiologist is the specialist in the study of the heart. They specialize in heart diseases and disorders of the heart. We have lots of great cardiologists in Santa Cruz County, and if you ever need to have a general, not a specific, but a general referral on someone you should see about heart problems, let me know. I know a couple of good cardiologists whose names I would pass along to you. Along with the heart, of course, which is the pumping action, we need somehow to move this fluid called blood, and also hydration, so water and other things around our body. We need vessels, and these are the veins and arteries when we talk about the cardiovascular system. Vasculo is a combining form for vessel. Vessel, it's a very traditional meaning. It just means to carry something or something to carry. So blood vessels, and we have other vessels in our body, but blood vessels specifically are about moving blood around the body. When we talk about the vessels, we refer to them as vascular. So if we had a disorder of the vessels, we'd say it's a vascular disorder. In the case of this chapter, it also happens to be the second half of the compound word, cardiovascular. Once again, we see the combining forms at top, cardio and vasculo. And cardiovascular is pertaining to the heart and blood vessels. Now here it does say vasculo often means blood vessels, which is true. We have more blood vessels in our body than any others. But technically, the term vessel can refer to other parts of your body, other tubes that might carry or move something from point A to point B. We can also build a bigger compound word, and we can use these words. We can kind of play with them. We don't normally put them in one word, but I guess you could have cardiopulmonothoraco. We have cardio, once again, as I mentioned. Heart, pulmono, you'll recall from our last lecture, is lung, and thoraco means chest. So if we want to talk about the cardiopulmonary system, in other words, the relationship between the heart and lungs, we would use the term cardiopulmonary, and this is pertaining to heart and lungs. If we want to talk about the relationship between the heart and the cavity it's located in, we'd use the term cardiothoracic and pertaining to the heart and chest. Perhaps you've heard of open cardiothoracic surgery before, which is where they cut the sternum, they intentionally break the ribs and open the chest up. Type of surgery you do not want to have. Long recovery on that one. However, if it is necessary, you definitely want to have it. You just want to avoid the necessity for it. You don't ever want to have a surgeon cut your chest open unless it's absolutely necessary. It gets complicated. And then we have cardiomegaly, enlargement of the heart. So that could be a pathology. It also could be someone who's trained very heavily in a certain type of athletic discipline, for instance. They may have something called left ventricular hypertrophy. It simply means that the lower left part of the lower left part of the heart is slightly overdeveloped than you would normally see and slightly more developed relative to the rest of that heart tissue. Okay, so our heart structure, we're going to start by talking about the layers. And our point here is just for you to take away the meaning of one suffix and to give you 4 prefixes or combining forms that we're going to be using. So you'll see them underlined here in this list of 1 through 4. Epicardium. Epi means on, upon, or over. Once again, focusing only on the prefix there. The next word, number 2, that's a combining form. We see myo, and that means muscle. Number 3, we're back to a prefix, endo, meaning inside or within. And number 4, we're also talking about a prefix, meaning around. And keep in mind that all of these have the suffix and is not just a word you use when you don't know what to say, but it also means structure. And I believe it's derived from Greek, although don't quote me on that one. So those are 4 word parts that associate with the words we're going to talk about. Now let's actually talk about heart structure and the layers. First thing we're going to talk about is the epicardium. Epi means up or on, upon, or over, and cardio, heart. And of course, once again, structure. Epicardium is the outer layer on the heart's surface. So if you actually could see a human heart, if it were sitting in front of you, what you'd be looking at would be the epicardium of that heart. That's the outer layer. And you can see in the diagram here, and those of you who are moving on to anatomy or have already taken anatomy will recognize this image and others similar to it. When you'll look at this and have to define what type of muscle tissue it is, and you'll know, because you'll have studied, that this is heart tissue. And we're seeing the epicardium right on top. So it's just that layer. It's kind of like the dermis layer. It's the outside layer. It's what you see, and it kind of encases it all, but it's not the whole story. You can also note on this slide, there's a middle section called the myocardium. We're going to look at that in a moment. And the endocardium is all the way on the bottom. So that's a great illustration of what we're talking about. Those are all the striations of the muscle that you see, kind of that swirly pattern there in the myocardium. And within them are those tiny nuclei that I pointed out earlier. Once again, skeletal muscle doesn't have all those nuclei. It's particularly the heart, or specifically heart tissue, or the myocardium, where you'll see those various nuclei. So our takeaway, epicardium, outer layer on the heart's surface. Now I just referred to the myocardium in the last slide, and now we'll discuss it. Myo is a combining form, meaning muscle. It's not the last time you'll see that combining form. Cardio is a combining form that means heart. Put them together, you have the myocardium, which is the middle muscular layer of the heart. And if we want to talk about it, we say myocardial, which is pertaining to the myocardium. So maybe this patient has a myocardio deficiency of some type. And if it's in the myocardium and it makes sense to use it that way, then we could use the term myocardial to describe that pathology. And so that's our middle layer. So that's a much thicker layer. This is the muscular layer, as I said. This is really the kind of the heart and soul of the heart, if you will. Pardon the pun. This is what causes the contractions and dilations that allow the heart to move. And allow the heart to pump blood, by the way. And then we have endo, which means inside or within, and cardio, once again, which means heart. So the same suffix applies, endocardium. This is the inside layer lining of the heart and its valves. If we want to talk about them, we can refer to them in pertaining to context, endocardial, pertaining to the endocardium. And here's our first pathology of the heart, endocarditis, inflammation of the endocardium. So we haven't gone through the flow of the blood through the heart, and I'm not going to cover it quite yet. But I want you to take a look at this diagram of the heart, and there's a highlighted portion that shows a heart valve. That is actually the mitral valve. It's a bicuspid valve. It's on the left side of the heart, and it's between the left atrium and left ventricle of the heart. And then we have an enlarged view to the right of that. The normal aortic valve, you can see that those leaves are pointing a certain direction. The arrows are indicating the direction of blood flow. So blood comes through that from the inferior through that valve to the superior. And those leaves that you see pointing up, they will slap back together like this once the blood is passed through. So every time there's a heartbeat, they close. And that closing helps the blood from flowing back into the heart. Because remember, the blood's under pressure. This is a hydraulic system. In a perfect world, that valve is holding that blood back, and it doesn't allow what we know as retrograde. If we look at the bottom picture, that does allow retrograde. So now you're looking at a similar heart valve. This time, it has something called endocarditis. It's a bacterial growth, and it happens on the endocardium. In this case, it happens on the leaves of that valve. So now, that valve, instead of being nice and sharp and crisp and able to hold that blood pressure and it can't flow backwards, now it's weighted down by this bacteria. It's been made weak, and now the blood not only pushes out, but it flows back into the heart. And this is a bad situation. Blood should only flow one direction, out of the heart, through the body, and back into the heart. It should not flow directly back into the heart through the mitral valve. So we have a pathology, endocarditis. Can be fixed usually with antibiotics and often requires hospitalization just to make sure that the patient is safe. Okay, there's a fourth structure I want to talk about. This is not a layer of the heart, but it's important to understand it. We're going to use peri now, meaning around, and cardio, meaning heart. And this gives us the pericardium. This is a thin sac that surrounds the heart. It is not a layer of the heart. It actually is a small container filled with fluid within which the heart sits, and it kind of works as a shock absorber for the heart, and it protects it, and it also keeps other structures away, so as the heart beats, it can beat freely. The pericardium protects it. So do note here, and this is true, it's not considered one of the three layers. The layers of the epicardium, myocardium, endocardium, and then this is a separate structure. It can have its own pathology, and if it does, and we want to refer to it, we say it's pericardial. For instance, there may be a procedure that's necessary. Once again, you remember centesis, and I always said surgical puncture, right? Well, in pericardiocentesis, a surgical puncture to remove fluid from around the heart might be necessary if there is excess fluid in the pericardium. And of course, referring back to centesis being a surgical puncture, we would not want to enter anywhere near the heart without having a sterile procedure, which is why I want to emphasize the surgical puncture part of this. We can puncture you by giving you a flu shot, but if we're going into the pericardium, we are not going to use an aseptic technique. We are using a sterile technique, and this is where centesis is so important to be designated as a surgical puncture. Okay, we got to this far. We got some layers of the heart, some structures. Remember, the pericardium is a structure. I'm going to pause it right here. When we come back, we're going to talk about the actual construction of the heart and how blood flows through it. So give me just a moment. I'll be right back with you.